Hello, my name is Dr. Dana Williamson, and I'm a chiropractor in Mechanicsville, Virginia. Patients will often bring in a CD that has an MRI of their lower back and ask the ultimate question: can you fix me? Or worse, they'll say, I think I need surgery. Sure, it's quite amazing how an MRI can slice through the spine and show bones, soft tissues, discs, muscles, nerves, the spinal cord, and more. Since the low back bears approximately 2/3 of our body's weight, you can frequently find many abnormalities in a person over 40 to 50 years old. In fact, it would be quite odd not to see things like disc degeneration, disc bulges, joint arthritis, and spur formation. Hence, the downside of having all this information is the struggle to determine which finding on the MRI has clinical significance. In other words, where's the low back pain coming from? Interestingly, in a recent review of more than 3,200 cases of acute low back pain, those who had an MRI scan performed earlier in their care had worse outcome, more surgery, and higher cost compared with those who didn't succumb to the temptation of requesting an MRI. This is not to say MRI, CT scans, and X-rays are not important, as they effectively show conditions like subtle fractures and dangerous conditions like cancer. But for low back pain, MRI is often misleading. This is because the primary cause of low back pain is functional, not structural. So it's easy to get railroaded into thinking whatever shows up on that MRI has to be the problem. Here's how we know this. When we take 1,000 people without low back pain between ages 30 and 60, male or female, and perform an MRI on their lower back, we will find up to 53% will have painless disc bulges in one or more lumbar discs. Moreover, we will find up to 30% will have partial disc herniations, and up to 18% will have an extruded disc, one that is herniated all the way out. Yet these people are pain-free and never knew they had disc derangement since they have no low back pain. When combining all of these possible disc problems together, several studies report that between 57% and 64% of the general population has some type of disc problem without any back pain. Hence, when a patient with a simple sprain, strain, and localized low back pain presents with an MRI showing a disc problem, it usually only confuses the patient, and frequently the doctor, as that disc problem is usually not the problem causing the pain. So don't have an MRI unless a surgical treatment decision depends on its findings. That is, weakness, numbness, and non-resolving low back pain in spite of 4 to 6 weeks of non-surgical care, or unless there is weakness in bowel or bladder control. Remember, the majority of back pain sufferers do not need surgery. We realize you have a choice in whom you consider for your healthcare provision, and we sincerely appreciate your trust in choosing our service for those needs. If you, a friend, or family member requires care for back pain, we would be honored to render our services.